Hi, my name is Barbara PICHLER, and I'm very pleased to be at the Alzheimer Europe conference and speak to you. I work as a member of the scientific staff at the University of Applied Science in Neustadt, Austria. I want to acknowledge my co-author, Verena Datzer and Katharina Heimel. It is a joint project with the University of Vienna. The project is funded by the Public Health Institution in Austria. Today, I present an extract of the interdisciplinary and participatory research project Dementia Friendly Library, Museum and Citizen Service Center with the title Public Community Organizations on the Pathway to Dementia Friendliness, Lessons Learned from a Narrative Approach. What is the purpose of the participatory health research project? It aims to promote the social participation of people with dementia and their informal caregivers, especially family caregivers. The project contributes to destigmatization, and the health literacy among the general public should be improved. 3 public organizations participated: the library, the museum, and the Citizen Service Center of Wiener Neustadt. Our assumptions were the library, the museum, and the Citizen Service Center of the city Wiener Neustadt are important in the everyday life of people with dementia and their informal caregivers. To get this organization involved is an important contribution to the development of the city Wiener Neustadt as a dementia-friendly community. Here you will find a brief overview of the entire project. The project had 3 phases: needs assessment, implementation and intervention, transfer, and sustainability. In my presentation today, I will focus on the focus groups with the employees. This was part of the needs assessment, and we worked with the results of the focus groups in the communication workshops. This also serves to illustrate the action circle in the project. Next, I would like to introduce the narrative approach we choose for the focus groups. 3 focus groups were held with staff members from the library, museum, and Citizen Service Center. Due to the pandemic situation, the focus groups took place online. It was really important to us that the employees of the library, the museum, and the Citizen Service Center tell each other about their experiences with people with dementia and their informal caregivers in their everyday work. We made audio recordings of these narratives and transcribed them. On the one hand, our aim was to stimulate exchange, and on the other hand, the aim was to generate knowledge. In total, we received 19 narratives about encounters with people with dementia and informal caregivers. What was the impact of the storytelling? It turned out that staff members have experiences with people with dementia and caregivers, and they really showed a high willingness to share the experiences with us and also with each other. It was our impression that the narrative method created an atmosphere of trust in the workshops. This is why participants were able to tell stories that had also touched them emotionally. As a matter of fact, this exchange stimulated them to reflect. Another point that is important for me to mention: knowledge in narratives is mostly implicit, but through narration, it is possible to make existing tacit knowledge explicit. The focus groups were about knowledge about possibilities, limits, and challenges to become dementia-friendly. Next, I would like to give you an example of the narratives. It's about how to recognize people with dementia. In brief contexts, dementia is often not obvious, but there are solid experiences to recognize people with dementia. This narrative excerpt from a library staff member is framed by a much longer narrative about a specific man who has been a regular reader at the library for a very long time, and for whom they noticed cognitive impairment over the years. I'll read the quote. There are several people where you can observe this, especially with regular readers over the years, and these are the typical signs. They no longer know where to find the appropriate literature. They do not know what they have read before. It is then about size, but books, actually no longer about the content, but about very, very different things. I will move on to the conclusion. Health, care, and dementia are not the core business of the library, the museum, and the Citizen Service Center. They are not healthcare organizations like a nursing home, a hospital, or a daycare center, but they can become a caring institution. For John Toronto, organizational places of reflection are the most important element of a caring institution. Places of reflection are needed when dealing with people with dementia. The narrative approach supports reflection. It is about the question how organizations can create places of reflection. To become a dementia-friendly organization, staff narratives help make tacit knowledge explicit. This knowledge is about their needs, but also the knowledge about their resources, opportunities, challenges, and limitation is necessary. Thank you so much for listening. If you are still interested in the overall project, I would be very happy if you contact me or visit the project website.